Hope you're all suitably refreshed and ready for the final session of this afternoon. I'm delighted to introduce one lightning talk and one digital story. So the lightning talk is going to be given by Helen Hoyle, and then the digital story by Davara Bennett. So thank you very much, Helen.
Thank you very much, Rona. Thank you very much, everybody, for staying to the end. Really appreciate your stamina. So, 20 years ago today, I was a teacher of geography and head of geography in the secondary sector. And I used to describe my first master's in landscape architecture as akin to a religious conversion. But doing a transdisciplinary fellowship in public health has arguably been more transformative for me, and I hope for the people that it will touch. During this, well, before this and ongoing, but in the first year of the fellowship, as part of a Master of Public Health, I worked really closely with Luton Borough Council. Luton is the first marmot town in England, 30 kilometres north of here. It's the most densely populated place out of London. And though highly deprived, it's one of the most super diverse, and positively so, places in England, with 55.4% of the population non-white UK. And the gap that this work addressed was to look at professional perceptions across the spectrum, from green space management to public health, of how we could harness nature-based interventions such as these meadows, physical things on the ground such as trees and green spaces, and activities such as therapeutic horticulture to address challenges and deliver benefits, and also reduce inequalities. I interviewed 16 professionals, and that work was built into a Heritage Lottery funded bid that I was working on with Luton Borough Council for a Nature Towns and Cities project. The findings of that research showed that the professionals were acutely aware of challenges such as obesity, childhood obesity, and mental health challenges across the whole population. And some of the issues were mapped onto particular at-risk groups, South Asian communities and women with lower activity levels, maybe, definitely. And yet there were real examples of thriving in nature at the other end. We see positives, holistic benefits, social, physical and mental, of spending time in green and blue spaces with their different characteristics, and also involving themselves in activities such as that enabled by Penrose Routes to Recovery, the team you see here in the middle. As part of that, we see increasing ethnic diversity in nature, with groups that maybe hadn't accessed nature so much, such as the South Asian communities, particularly within allotments where the great diversity of Luton's population is thought to be best represented. As I said, during that period, I was working on this bid, and we were successful. I'm one of two academics working in a big team, and we've been awarded this Natural England Heritage Lottery funding. On Monday, I'm going to Luton to do the first of 14 workshops with 7 primary schools across Luton, across the whole range socio-economically and spatially through the town. We really want to know what the children think. We're working with Year 5 children. Each school, each group of Year 5 children will be assessing nearby nature within a walking distance of the school, talking about how they value it, if they value it, how they value it, what they value it for. And then in the second workshop, they will be in a creative, participatory space, reimagining those places to make them better for themselves and for nature. None of this would have been possible. Maybe we wouldn't have got the Luton bid without the School for Public Health Research. So thank you to all of you. Thank you to the training team for the fantastic support I've had over the last 21 months. I think I will probably for the next 3. And particularly, I know she's had to leave, but to Professor Liddy Goyder, who has given me so much pragmatic advice, friendship, and her frequent flashes of genius, which I often refer to. So thanks, everybody, for staying to this point.
I used to be a key worker. My job was to support care experienced young people to achieve their goals, and I was obsessed with this question of how to improve outcomes. I'd lie awake in the sleeping room between shifts, thinking about it and feeling that I didn't have enough answers. So when the NIHR School for Public Health Research funded my PhD, I was driven to make an impact. I wanted to help reverse this huge, unsustainable rise in children being removed from their family homes in England. During the PhD, I published 5 papers, all of which proposed solutions to the growing public health crisis. A key finding is the massive contribution of rising child poverty to trends in care entry. But publication was just the beginning. I collaborated with researchers, care experienced young people, practitioners, policy entrepreneurs with shared goals to tailor the evidence to different audiences. We worked really hard to get the evidence into key strategy and policy documents, these blueprints for change. We kickstarted conversations about how we're failing children and families. We did this in Parliament, in the House of Lords, Prime Minister's questions, and in the media, hopefully people's living rooms. We estimate that the media coverage was seen, read, or heard more than 159 million times. This is key to changing the way people think about and talk about the problem. Finally, the research has directly led to our research development network for children at risk. The network will keep this problem on everyone's agenda. We've started by collecting stories from care. Our storytellers are telling it like it is, in their own words and their own voice. And when they speak, rowdy rooms fall silent. And a special shout out to Mia, who's been my co-author and fellow traveler in this impact journey. All together, we're mapping out the research of the future and demanding change. I'm really proud of this legacy.
Okay, now it's time for some prize giving, which is very exciting. Here are SPHR Trainee Awards. So first up for poster prizes, we're pleased to provide a special commendation to Helen Hoyle. And our winner is Joseph Bacon. For our digital story prizes, we had so many excellent submissions that we actually have 2 co-winners, and those co-winners are Francesca Murley and Libby Haynes. Okay, and for our lightning talks, our runner-up is Jax Bennett. And our winner is Lucy Anderson. I'm now going to hand it over to my esteemed colleague Ashley Adamson to embarrass Professor Rona Campbell.
Okay, so Rona, would you like to have a seat?
Oh, thank you.
We're not going to be here too long. I think some of you will have heard from Rona, and certainly at ResNet we did, that Rona has made the decision, and a sad decision for me, but a delightful decision for Rona, that she will retire in August. Now, we're going to see, some of us will see Rona again at Exec in July, at our executive meeting. And of course, Bristol colleagues will be spending their time to say goodbye to Rona. But I thought we should just take a minute to say thank you to Rona, not goodbye. Rona and I have worked together for over 15 years. We were each part of the UK CRC centres for Decipher and Fuse respectively, and originally they were led by 5 men. So we thought we probably should do something about that. And Rona took over for Decipher, and then ultimately myself, Fuse, and of course now Sheena Ramsey, my colleague in Newcastle, does that. So we did a bit to address the gender balance. In 2017, I came in as the incoming director of SPHR, and I was really pleased that Rona joined me as the deputy director, and I really, at that time and forever since until now, have really valued Rona's wisdom, patience, friendship, and we worked so hard together and in such good partnership to change and develop SPHR to what you've all heard over the last 2 days. But Rona, at that time, we've got to remember, and I don't think people remember this, that we had no capacity building funding. We had no capacity building function at all. So, and we'd managed to sneak in a few PhDs, but other than that, we had none. And in 2018, we were asked, would we be able to develop some PhDs? And of course, what did we say? We said, yes, of course we would. And Rona took on that dedicated capacity building and looking after the capacity building function in IHR. So we jumped in at this chance, and since then, we have developed that and got further funding to be able to now, by 2022, I'm just going to see if I can go forward one. I will just say, can I just take a point for a second? These are just some of the images of Rona's care, support and attention and mentorship of our trainees. And that included during a really, really challenging part for people starting their PhDs, trying to complete their PhDs during COVID. And we've got to remember how hard that was for everybody, but for early career researchers who really need to be in that environment of learning from others. And so Rona made that happen along with Andy, and then by that point supported by GJ, and really made, I think it was mentioned yesterday, but that our trainees feel supported and cherished, but also get access to the amazing expertise and networks across the school. So we then developed that, and this was not going on, so if somebody else can do that, that would be great. No? I'll try this one. Okay. So behind all of these numbers, this is the number. Rona, can you see that slide? So
even with my varifocals,
55 summer internships, and we've just heard from the last block of digital stories was a summer intern, the prize winner summer intern, 6 weeks to 8 weeks of time in the summer for undergraduates supervised by PhD students. We've had 55 pre-doctoral, PhD studentships, doctoral fellowships, transdisciplinary placements, transdisciplinary fellowships, and pre-application support. 182 awards for capacity building. And so hopefully this is about that individuals growing capacity in public health research and health improvement research, wider determinants upstream, and having that opportunity for the 182 people. And I know every single one of them really values that opportunity. Long may it continue. Rona, on behalf of all of those 182 people and everybody here and the wider school, thank you. Do you want to say? We have time.
Well, I don't want to detain you any longer because I'm sure lots of you have got trains to catch. But just to say thank you very much for such a lovely and embarrassing speech. All I can say is it's been a huge privilege to do this job. I've had a long career, but this has been really a real highlight, being able to support all these people. And it's also just been really fun, even in the tough times, because as Ashley said, we went into COVID fairly early on in this journey. And I will miss all of this and miss this meeting. It's really a lovely thing to enjoy. But thank you all very much indeed, and particularly thanks to Ashley. I just want to tell one anecdote, which was when I became deputy director of the school and with this responsibility. Ashley went to tell Chris Whitty that she was thinking of appointing me, but she was a little bit concerned because it was going to be 2 women. But happily, Chris said that was absolutely fine.
What he actually said was, I said, does it matter if it's two women? He said, Ashley, have you seen how many men lead different parts of NIHR? I think it'll be fine. And you know what? It was
fine.
Thank you.
Thank you.
Okay, so we're on the final stretch now, and you'll be really pleased to hear that I'm not going to try and recap everything you've just heard over the last 2 days. I'm just going to keep you a couple of more minutes. So I wanted just to say some thank yous. Obviously, thank you to Rona, to Penny May, it's just gone to GJ, to the people that are the support, our executive, and everybody who is just so positive, as well as the people who have made today possible, our colleagues from London School and Imperial. More on others later. I want to say thank you to our speakers, our digital story makers, our chairs, and also to people in the audience who've said, well, I'm not really doing anything today or tomorrow or yesterday. Yeah, you've all been doing something because you've all asked questions, you've all listened attentively. And I also hope that you'll take some of the things you've heard today and also things that people have asked for. And if there's things in your networks where you think you can amplify the research that's being done, and advocate for that, or share some of the contacts in your networks with those people, then please do that. All of the recordings for today, yesterday and today, will all be available on a YouTube. Not tomorrow. We're going to probably lie in a dark room tomorrow, but they will be there, and so you'll be able to look back through those. So do share them with others. Those digital stories are so powerful, so quick, but have so much content. I want to say thank you to our colleagues at Beacon House for once again, for their excellent support that makes sure that we keep on time and everything else. And my counter is still counting down, and I'm still okay. And also to the people at British Library for this beautiful venue that we've been able to enjoy. They weren't very sure about the vegan food. I'm just going to tell you. I had a conversation. I would like you just to particularly acknowledge our directorate in terms of, we've got Amy Johnson, our comms manager, Michelle Wilson-Chalmers, our knowledge broker, Laura Fennick, our administrator, Laura Ritson, who leads on our prevention programme, but also particularly to Dr. Susan Bowett, who keeps us all on track and putting this together when actually we are a person down in our training manager for the post. We're keeping the ship going. Can we just all acknowledge our fantastic director team? So the past 2 years, I think and the past 2 days, we've shown how we've worked together and with research, practice, public health, and collaborate on research to address really important policy questions, and to think about how our findings our findings can actually get into practice and look for dissemination. We heard today from Professor Lucy Chappell. Things are changing. It all makes us feel a little bit uncertain. Things are changing across our funders, across NIHR, as well as everything that's going on in the world. And for those that haven't seen the news, Wes Streeting has resigned. So let's see what tonight brings. But NIHR, Lucy talked about transition, integration, but the thing I will take away from today, and what Lucy said today, was that she also talked about the need for an and/or. So integration, but also that doesn't mean there isn't space for that dedicated support and funding for public health research and capacity building. So let's watch this space. We'll all be back again next year. And what I want to do is make sure that we use the time between now and 2029 with our additional funding to continue to advocate across all of your networks for the importance of the work that we need to do and the job is not done. And also to continue for us to continue to deliver excellent research that answers the key questions for policy and practice, and to make sure that we translate that into work that actually can have an impact and we capture that impact. So that's what we've got the next 3 years to do, whilst we work out what the future is going to be and making sure that we all have a voice in what that future is. So on that, and I think we promised we'd finish by 4:30, and it is 22 minutes past. So thank you all, and have a safe journey home. Let's hope the trains behave themselves.